It really is striking when you think of the number of patients, Joe, and I don't know if you, I mean, when I first heard about this, that so many patients are going to amputation, never even getting a vascular consult, never even finding out what is driving the problem with their
Is that
leg.
an access issue? What's the issue here? Is it economics, access? Is this a disease that sneaks up on you, that gets smuggled in? Are there no breadcrumb trails to this? Where does that lie? I mean, Dr.
We do know
Baker.
that statistically significant, statistically speaking, 90% of patients that have PAD are asymptomatic. 10% of them have some stable symptoms, and about 1% of them are the ones that are coming to us. Now, the problem is that 1% comes already at a stage where you're very well and eloquently exposed. We're now, trying to move back the clock of time. So instead of doing promotion of health, we're just then pouring all the, all of our tools into trying to pull that patient back to a stable position. We've gone as far now in our group here at Baylor College of Medicine in Houston to really mimic the nomenclature of cancer, because you're not going to cure these patients. You just bring them back to remission, and then you create a surveillance program to try to keep them out of trouble, optimize medically, optimize health, lifestyle, exercise, diet. But that's a problem, is we are getting a little bit too far down. So to your question, in full circle, does it sneak up? Yeah, it does. But we have gotten better at recognizing, and we should get much better at going out there and finding the areas where these patients are, and trying to understand who they are, and then do all the risk factor modifications that we can in order to prevent that transition from the asymptomatic to the stable, and then to the unstable and more end stage disease of this peripheral arterial disease monster.